Joining us now to break down the report, Eli Lilly CEO David Ricks. And we know how we've seen this movie before, I think, David. Things do get very excitable about great products. Like your stock's up 50%. It's almost got to $1 trillion, which would have been the first drug company, I think, ever to get there. So there's been great things happening. Is this 3 steps forward, 1 step back? How do you view it?
Well, we had a really strong quarter, so I know there's a difference in what the street expected. But to be honest, we're pretty pleased with how things turned out. Up 42% year over year on the right compare. I think that's a pretty small group of companies our size growing at that rate. And sequentially, if you look at in-market prescription growth, it's actually accelerating in the U.S. So while reported sales are, I know, light compared to the street estimates, we're on track with what we want. We are taking a little bit off the top of our guide, because during the quarter, I think we changed an assumption. We changed the assumption that we should start promoting and launching sooner in the U.S. and in other markets. And we basically pushed some of that out into Q4 because of customer service levels. So we want to make sure people, when they get a prescription, can fill it. We understand that's a frustration for our customers. So we relaxed that constraint a bit. And so there's a little lighter demand in the year and now projected. But overall, I think we're in a pretty healthy shape, and underlying demand is extremely strong.
I'm trying to understand this. So you concede maybe demand is a little bit lighter, and then in terms of lowering, as you said, the street was expecting this, but the street was basing their expectations on your guidance, and your guidance on the top end for revenue did come down a little. Is that 100% of that because of the customer service concerns and pushing it into the fourth quarter, or anything else to account for the high end of the yearly guidance coming down?
Yeah, it's really that. I mean, we moved out plans to advertise and promote Zepbound, which we're not really doing right now. We're just starting that now in Q4. So here in November, mid-November on, we'll begin that in the U.S. And then outside the U.S., we held back on launches. So those activities which drive revenue, we slowed down a bit because we want to make sure our inventory levels at Lilly and in the channel rise. Now, I think Angelica was speaking earlier there about the channel dynamics, which we cite in our press release. And we did have a lot of inventory going into the quarter. We had a lot less going out in the channel. So I think this is not a function of supply, though. It's a function of these wholesalers and retailers having capacity and wanting to stock every dose, which they often don't. So, we're just balancing all these parts, and there isn't excess supply, but we haven't been stimulating demand the way we had originally planned. So we're pausing that a bit. We did pause that, but we're restarting here. So, look, the growth story though is fantastic underlying this, and incretins which are Zepbound and Mounjaro, are growing pretty dramatically. We plan for that to continue.
Yeah, Dave, it's nice to talk to you again. But it's interesting because last quarter you were saying that you really didn't even need to promote Zepbound. It was basically promoting itself because there was so much demand. And now it sounds like you're almost saying that you need to go out there and do more promotion. Is that right? Or you see demand softening at this point?
No, I think if we had juiced promotion in the quarter, we might have risked on some dosage forms people having a bad experience, going to the pharmacy counter and not having it available, et cetera. Again, there's this supply chain is very tightly managed. We're still in the growth. We're investing heavily, as you know, in that. We're still in the growth phase of that, expanding capacity pretty dramatically. We're on track to hit our goal of at least 50% year-over-year growth in the second half of this year versus second half of last year. But when people go and they can't get their medicine, they're very frustrated. They tell us that. So, we didn't want to send more people to do that necessarily. That said, underlying sequential prescription growth is up 25% Q3 over Q2. So, a lot more people went to get the prescription, even though we did not promote. But we are going to start that because we do expect even greater expansion in our manufacturing capacity exiting the year and into next year.
And how much of the supply situation has to do with the fact that you want to make sure that tirzepatide is available so that it's off the FDA's shortage list? Obviously, that's been a big issue with you and the compounders. So how much of that dynamic is at play here?
I mean, it's a factor. Our key indicator, though, is fill rate at the pharmacy counter for consumers. So when that is slipping down, meaning people are unsuccessful in fulfilling a prescription the first time or the second time, that's when that's what we pay attention to. A byproduct of that is what the FDA decides to do. We don't really control that. We give them the relevant information, how much stock is at Lilly, which, as I said, we have available supply on all doses of Mounjaro and Zepbound, and they make a determination whether it's in shortage or not. We agree it's not in shortage because we have stock.
The other issue, David, are these copycats. I know you're going after them, suing some of them, but is that like a whack-a-mole game to try and come up with the biggest copycat issues on this? What risks are there for consumers if they're going that route instead of going through a doctor?
Yeah, I mean, the primary concern there is one of safety. A lot of these outfits are dispensing drugs without doctor supervision, certainly not an in-person visit. They are not FDA regulated. They claim they're regulated by state boards of pharmacies, but I don't think they're getting inspected. They're not approved drugs, really. So we've created a world here where there are these knockoffs that people can access, and our point of view is that needs to get put back in the box. We have the FDA for a reason, which is we want to have consumers confident when they go to get a prescription that it's the dose and the medicine that they expect it to have, and it's safe and effective. None of these other guys can say that.
How much of a frustration is that, and what do you think the government should be doing?
Well, I think it's not really a business matter for us, as we just talked about. We're sort of selling what we make, and it's a tight supply chain for us. I just worry long term if we're sort of avoiding the real issue here, which is coverage of these medications on insurance. I think that's really what's happening is people want to buy a lower priced product, even though it's lower quality. It's not a real medicine. It's not an approved medicine. That's what compounding is. What we need to do is bring those people into the insured system. And, if we have other diseases like diabetes or hypertension, we expect our medicine to be covered by insurance. Why is this different? That needs to change. I think that's the primary thing I'm worried about.